To the dais, our Honorable Health Minister, Sir, Sri Kekhob Mahanta, Sir, Sri Avinash Joshi, Sir, to the dais, MD NHM, Dr. MS Lakshmi Priya, Madam, Professor Parameshwar Iyer, Sir, Dean IIT, Mr. Girish Krishnamurthy, MD CEO, Tata Medical and Diagnostics Limited, Dr. Rajani Ved, Madam, Director Health India Country Office, Bill Melinda Gates Foundation. Today is an auspicious day for Health Department of Assam. Memorandum of Understanding will be signed between NHM Assam, Tata Medical Diagnostics Limited, and Indian Institute of Technology Guwahati for pilot implementation of primary and secondary healthcare transformation in digital nerve center platform in North Guwahati Block PHC Kamrup district. Now we'd like to felicitate all the dignitaries in the dais from NHM Assam. Now I request IIT Guwahati to give the present token of love to our esteemed dignitaries. Thank you, sir. Now I would like to request Madam Dr. MS Lakshmi Priya, Mission Director, National Health Mission Assam, to deliver the welcome speech.
Thank you, Deepjyoti. Good afternoon to everyone. Honorable Health Minister Shri Keshav Mahanta, Honorable Additional Chief Secretary, Health and Family Welfare Department Shri Avinash Joshi sir, Honorable Dean, Public Relations, Branding, Ranking and IIT Guwahati, Professor Parameshwar Iyer sir, Honorable MD and CEO Tata Medical and Diagnostics Limited, Mr. Girish Krishnamurthy, Honorable Director Health, India Country Office, Bill and Melinda Gates Foundation, Dr. Rajani Ved, all the faculty members of IIT Guwahati, Joint Director and Additional CMNHO, and District Program Officers of Kamrup District who have come today, the KMU and BPMU of Kamrup District, all the SDMNHOs and Sectoral Medical Officers of Kamrup Districts who have Kam here, BPMU of Kamrup District, My dear Asha workers and Asha supervisors and media friends from media and ladies and gentlemen. So this is a happy day for us because we have an existing system. আমার যে existing health system আছে health system আশার পৰা আৰম্ভ কৰি পেলাই আমি ডাটা কালেক্ট কৰি পেলাই যাক যাক কি সার্ভিসেস লাগে এটো আমি ন্যাশনাল হেলথ মিশনের অন্তর্গত আমি almost 40 national programs of divide kori pelai available services ami provide kori asu. In addition to that, we are also providing health services under the state government's health system also. Therefore, all the available resources, demand resources available ase, gute kita resource ami integrate kori pelai eta approach loi goi asu. Apuni jane ami 104 call center 104 number যদি ডায়াল করে আমার কল সেন্টারত কানেক্ট হয়ে যায় তারপরে যে কোনো ধরনের সার্ভিসেস আমার মানুহে পাই আছে তার এটা নেক্সট লেভেল সার্ভিস ইয়াতে ডিজিটাল নার্ভ সেন্টার যোগেদি আমি প্রোভাইড করব পাইলট করব বিচাৰিছো যে যাক যে সার্ভিস লাগে সেই সার্ভিস তেখেতলৈ আমি কেনেকে অ্যাভেলেবল কৰিব পাৰো বুলি সো আমি এতিয়া এটো পাইলট স্টেটতে এটা ব্লকতে কৰিম কামৰূপ ডিস্ট্রিক্টৰ নৰ্থ গুৱাহাটী ব্লকতে কৰিম কেইটামানো কম্পোনেন্ট আছে এটা কল সেন্টাৰ কম্পোনেন্ট আছে আৰু আশা সুপাৰভাইজাৰ্ছক আকৌ এটা ওৰিয়েন্টেশন দিয়া যাব আৰু কেনেকে আমি যে ৰিকুৱাৰমেন্টস আছে আমাৰ পেশেন্টস বিলাকৰ পপুলেশনত যে ৰিকুৱাৰমেন্টস আছে এইটো আমি অ্যাভেলেবল সিস্টেমৰ লগত লিংক কৰিম দিস ইজ আওয়ার project that we are starting now. মই এটা কথা এতিয়া ৰিইটাৰেট কৰিব বিচাৰিছো what I wish to reiterate ma'am and Mr. Krishnamurthy what I wish to reiterate is that we are looking forward to having a system to strengthen the existing health system of the state. So what we will be happy to associate with will be a mechanism that will strengthen the available resources in the state and how we can better our health service providing health service to our people. So this is what we are looking forward to having, and I am sure that a lot of processes will be involved in this project by way of which we will be able to strengthen our existing health system. In addition to that, I would also like to mention that this is a pilot project, and based on the success of this project, we will see if we can adopt it further in the other parts of the state and other parts of the district as well. মই আজিৰ এই প্ৰগ্ৰামৰ কাৰণে আহাৰ কাৰণে অনাৰেবল হেল্থ মিনিষ্টাৰক আন্তৰিকভাৱে মই স্বাগতম জনাই আছো additional CSRক স্বাগতম জনাই আছো both our partners, now we should call ourselves partners, from Tata MD, IITGuwahati and Bill and Melinda Gates Foundation. I welcome all of you, wholeheartedly welcome all of you to the state of Assam and also to the health system of Assam, and we are really looking forward to improving our system by working together and focusing on our process improvement. And I welcome all my friends here from Kamrup district, starting from our Asha workers to the joint director who is here. Hokkuloke moi antarik bhabe swagatam janai asu aru moi asha rakhi asu je tekhetor je intervention ase he intervention ব্যবহার কৰি পেলাই আমাৰ নিজৰ সিস্টেমক আমি আৰু ভাল কৰিব পাৰে বুলি সকলোকে অভিনন্দন জনাই আছো আৰু আকৌ স্বাগতম জনাই আছো থ্যাংক ইউ
Thank you, MD Madam. Now I would like to request Mr. Girish Krishnamurthy, MD and CEO, Tata Medical and Diagnostics Limited, to give brief presentation about the project.
Good afternoon, Honorable Minister. Thanks for having us here. Honorable Additional Chief Secretary, NHM Director NHM Madam, and my colleague and partner from Melinda Gates Foundation, and IITGuwahati, Dr. Parmeshwaran Iyer. Thanks for hosting us and being part of this project and the journey. I just want to quickly run through the background of this project. This project was started about 1.5 years before Honorable Minister, Chief Minister invited Tata to come to Guwahati and explain various healthcare initiatives and innovation we have. Based on that, few months later, Honorable Chief Minister with his team visited Mumbai and met our chairman along with various CEO of Tata Group companies to be part of Assam's growth and the future. I was fortunate to be part of that meeting. In that meeting, Chief Minister was very clear. The model what we are evolving should be tested in Assam. We have done in the state of Karnataka and few other states. He said Assam is a different state. I invite you to come to Assam and do an experiment in Assam and see how well you can improve this further. Subsequently, Honorable Health Minister immediately within 2 weeks, along with the whole health team, visited Kolar district in Karnataka, very close to Bangalore, and did a detailed review of what we have done and whether that is suitable for Assam. Post that, NHM Madam, along with his team, sent a team to Kolar to really understand what we have delivered and what we are doing. And further, IIT Director Parmeshwan Iyer also visited Kolar. A detailed analysis been done and decided that this project can go forward. At that point of time, our discussions with Mr. Gates of Gates Foundation was very keen in intervening improvement in public health system. Met with our chairman as well as Mr. Ratan Tata and decided to participate along with Tata in various programs. As part of it, Dr. Rajni also visited along with the Gates Foundation team to Kolar. And all these experts, along with the NHM team, did a lot of introspection and decided that we will go ahead with this project. So from Tata MD and the overall Tata Group perspective, along with Melinda Gates Foundation, it's a proud moment for us to participate and do a pilot in Assam. With that background, all of us have come together and today we are signing up an MoU to do a first pilot and incorporate all the different, see already Assam in the last 3-4 years or even last 7-8 years been consistently doing a fantastic health system improvement. And we can see the ACSR is here, Madam NHM, there are a lot of initiatives they are taking and a lot of improvement, so with the existing government health system, bringing all our capabilities from Tata and Bill Melinda Gates Foundation, we want to further strengthen to the benefit of the citizen. That is the objective of this project. I'll quickly go through our experience in this field. See, to strengthen the public health system, we have been working on 5-6 years. Almost from 2015, we started in All India Institute of Medical Science. In All India Institute of Medical Science in New Delhi, used to get about 10,000 new patients every day, and they used to struggle. A patient to see a doctor for 2 minutes, sometimes it used to take multiple days. Sometimes it used to take 20 days, sometimes it used to take two days. Minimum it was taking 2 days. We reimagined, developed a new process and system and ensure that every patient gets absolute care in AIIMS in 2 hours time. Subsequently, we have done a lot of work in cancer care. Most importantly, in rural India, along with the public health system, with the government, we have implemented multiple projects. In Kolar, in Karnataka, there are about 20 lakh population, 2 million population. Every citizen's health is being taken care by this system, by the public health system. And after we took over, started this project, consistently, every metric in Kolar has improved. I'm pretty sure, given the kind of public health system leadership Assam government has, and along with IIT Guwahati, this project will become very, very strong impact it will create. Now, the overall Kamrum district is the initial pilot we have selected. Our team has done a basic study. Now, if you look at it, every sub-center, every primary health center, every community health center and civil hospital, area hospital, block hospital, any health infrastructure will be connected. The fundamental principle behind this is 5 important philosophies. Number 1, it's a continuous care because our citizens requires continuous care. It is not one time you fall sick and you go and see somebody and come back. So what is required is a continuous care. And second is a connected care. When we say connected, it is not just a computer connection or a phone connection. A connected care where all the health ecosystem, whether it is diagnostics, whether it is a primary health center, or a sub-center or a wellness center, or a district hospital, all of them operating in unison to make an impact to the patient. Also, most of our health system currently is reactive. Once you fall sick, you go to a doctor. You become little well, then you forget. Whereas a proactive management of healthcare is very critical, and especially in mother and child and non-communicable diseases like a diabetes, hypertension, those kind of areas, a proactive care is very important. Also, if you look at our health system, if patient falls sick, he has to go and find the doctor. Never doctor finds a patient or health system doesn't find the patient. So a patient-centric model is very critical. Also, close to the patient. When I say close to the patient, it's not the distance. The distance from your house to primary health center or a sub-center is one aspect. In terms of dearness, not only near, but you need to be dear to your citizens. And these are all the objectives and the principles of this project. With the help of Government of Assam, Health Department, as well as with the help of Melinda Gates Foundation and IIT Guwahati, I am pretty sure as a team, we will implement this project successfully. Currently, the way we are looking at it is very fast, aggressive program. What we learned over a period in health system is, if you don't do it fast, quickly, within 4 to 5 months, it loses its importance. You need to give quick results. The world is changing very fast. People wanted to see results very fast. So we have a 2 milestone. There's a milestone for 45 days. There's a milestone for 120 days. We will launch it very quickly in 45 days and then develop a rollout model within 120 days, which is very aggressive. Of course, it has got a lot of challenges, dependencies. We need support from everyone, and public health system, health officers, health workers, and more importantly, to reach out to the patient. And then most of our team, we are planning to put here from the local Assam team so that language isn't a problem. And experts will come from the Tata team and Gates Foundation team, but mostly we would like to put local people. It not only creates employment locally, and more importantly, the project can succeed better. So with that idea, we have come up with the rollout plan. Also very important, if you don't continuously monitor and manage this kind of a pilot, it loses its track. So the commitment from the senior leadership, we have put together a governance structure along with the health team. Every person, IIT Guwahati, Melinda Gates Foundation, Tata, and the Government of Assam Health Department will be there in every structure, from the sponsorship to steering committee governance to and implementation. A weekly review, monthly review happens, and we report very regularly to take actions quickly. So that is a model we have created. With the help of all of you, I think this project, this pilot, will make Assam state very proud to be a leader of creating a very unique model for the nation. I'm sure 1 year from now, a lot of people from the Government of India and other states will be talking to the Government of Assam to see how they can replicate the same thing in the state. With that, I will close my talk. Thank you for the opportunity.
Thank you, sir. Bill and Melinda Gates Foundation will be strategic partner for this pilot project. Now I would like to request Dr. Rojanibet, Madam Director, Health India Country Office, Bill and Melinda Gates Foundation to deliver her speech.
Good afternoon, everybody. Respected Shri Keshav Mankaji, Honorable Health Minister, Government of Assam, Shri Avinash Joshi ji, Additional Secretary, Health and Family Welfare Department, Dr. Lakshmi Priya, Mission Director, MHL, Shri Girish Krishnamurthy, MD and CEO, Tata MD, and Professor Iyer, IIT Guwahati, state level officials from NHM, district and block level teams from Kamrup and Ashas. Thank you all very much for inviting the Gates Foundation to be part of this very important event. At the signing of the MoU. Thank you. So it's especially a historic moment where there is an MoU being signed between the state government, between IIT Guwahati and Tata MD to launch what is considered to be an innovation that brings together patient-centered care, technology, as well as working very closely with the district and state health system to demonstrate a new model for primary and secondary healthcare strengthening. I'd like to commend the government of Assam for its continued leadership and sustained commitment in strengthening healthcare systems to improve the lives of the people of Assam, particularly with a focus on the vulnerable and the marginalized. The government of Assam actually has a very illustrious history in being at the forefront of implementing innovative healthcare solutions to advance the key health indicators and has demonstrated actually several good practices which are being replicated across the country. At the Gates Foundation, we are guided by the mission that everyone deserves a chance to live a healthy and productive life. We are honored to partner with the government of Assam, Tata MD, and IIT Guwahati for this path-breaking initiative. We believe that this collaborative partnership will help in accelerating progress towards health for all, which is a mission of the central government as well as the state government. Now, this innovative model builds on the digital expertise available in the country, the government of Assam's commitment to innovative healthcare solutions by bringing together patient care coordinators within the existing health systems, building together processes for quality care service delivery and patient support mechanisms. The partnership has great potential for success given the organizations involved, and the Gates Foundation is very privileged and honored to be part of this collaboration. Tata MD, of course, has deep expertise, as you heard from Mr. Krishnamurthy, in implementing such innovative models across some parts of the country. IIT Guwahati will undertake the learning and the concurrent research component for this intervention. Active engagement of the Department of Health, particularly the district and the sub-district teams, are critical to the implementation of this project, especially if we are to look to this project to scale up across the state and even across the country. We hope that the learnings from this pilot will generate the evidence that is needed to support scaling up. The recent launch of the Global Initiative for Digital Health by the World Health Organization and India's G20 presidency is a strong indicator that India is embarking on a digital healthcare era, and Assam is leading the way through expanded use of digital public goods. This pilot in the state of Assam will certainly be an exemplifier for innovation in healthcare delivery. I would finally like to reiterate the Gates Commitments Foundation to this pilot, as well as to supporting the state government of Assam in learning lessons from this pilot so that we are able to scale it up across. Thank you very much.
Thank you, Dr. Rojanibet, Madam, for your valuable inputs. IIT Guwahati will be collaborating in this initiative as an academic partner. Tata Digital Nerve Center, a key component of the model Digital Nerve Center, will be established in the IIT Guwahati campus. IIT Guwahati will conduct research and drive technology-led innovation in healthcare domains. Now, I would like to request Paramesh.
And in fact, we are very privileged to have with us Shri Keshav Mahanta sir. Sir, welcome to IIT Guwahati once again. You have been with us for so many other events, and every time we see that the energy, enthusiasm you bring in other projects that we have been discussing with you, we promise you that we'll take forward, all these initiatives in the best possible way. We are also privileged to have with us Shri Avinash Joshi sir. Sir, welcome. Lakshmi Priya madam, Girish Krishnamurthy sir, and with madam from Gates Foundation. First time madam is coming, but I was told that she has been working at IIT Guwahati or in the Guwahati region, in Assam region for the past 8 to 12 years, and we hope that she comes back here for initiating other projects as well. So this is a great opportunity for us to also collaborate with Gates Foundation for many other projects along with Tata and other agencies in the state. I think this is a great opportunity that IIT Guwahati has got. Another opportunity, we have been working very closely with the state government in establishing a medical college at IIT Guwahati. So we are very fortunate that we have got this opportunity to diversify into the healthcare sector. And the model that IIT Guwahati has adopted, it's very different. We are developing a PG hospital completely by the support of the state government. This is again first time this model has been initiated by a state government and a centrally funded technical institute. So it's a connected hospital, and what even Girish Krishnamurthy sir told, the connection part, what we are saying is very unique, and definitely we would like to contribute as much as possible in the data part as well, the data handling, and then analyzing it and seeing how we can do much more and provide support to the millions of citizens not of this region. But we want to be a model that can be replicated for a lot of other things in other parts of the country. So this is something that at IIT Guwahati we look forward to with the support of our faculty members, as well as the efficient students, the research scholars, other industries that are already there, startups that are there. We have very good entrepreneurs. So this model is not only for analysis of the data, but also the devices that this nano center or the health science center or school and other on this department that are developing, we all can also integrate that. So I think it's a great opportunity, not only for the industry, but also for IIT Guwahati to learn, to contribute, and work very closely with the state government in a lot of upcoming projects. I had this great opportunity to visit Kolar and look at various projects that are being implemented there, and definitely that model can be replicated and should be replicated because there are a lot of government schemes which are being rolled out continuously, and I really saw that how they can be implemented or organized in a proper way with the help of good efficient doctors and nurses who are part of this center. So I think this is something that we look forward to, and that's what we can learn from the center at Kolar. Even Keshav sir has visited there. Our former director also visited there. So I think it's a great experience. Everyone has a common opinion that this is something, if it comes here, it will definitely benefit, and we can focus on improving the overall healthcare sector in this region as well. So IIT Guwahati is definitely extremely excited to host this Tata MD's Digital Nerve Care Center at IIT Guwahati campus, and we will provide every facility, every expertise that is available with us to ensure that this program is successful. Definitely, this is going to benefit our thousands of students who are present here, but definitely, it can also benefit implementing, as I mentioned, a lot of other projects. We can also combine it with other healthcare projects that we are looking forward to. So this is a great opportunity to my colleagues who are sitting here, research scholars who are sitting here, that we should see how we can take this initiative even further, not just limited to the small initiative that we have begun now. So this is what we look forward to, and we will definitely collaborate with all the agencies responsible for taking forward this proposal. And IIT Guwahati will be collaborating as an institute, as a knowledge and a research partner, but definitely we are also looking forward to develop a lot of healthcare models. We have expertise in even mathematics department and computer science department who are working on this aspect. So this is something we really are looking forward to diversify and contributing in a very, very big way. I'll not take much time, we'll move ahead with the function, but before ending, I really look forward to the support from every agency, every organization, from our healthcare workers here who are present here, and hopefully, we can join hands together and ensure that this project is a great success. So once again, welcome to IIT Guwahati, and hopefully we can, take forward this relation. Thank you very much.
Thank you, Professor Iyer sir, for your valuable inputs. Now I would like to request respected Additional Chief Secretary, Health and Family Welfare Department, Sri Avinash Joshi sir, to deliver his speech and guide for successful implementation of this plan.
Good afternoon to all of you. Honorable Health Minister Keshav Mahanto Dangaria, Professor Iyer from IIT, Sri Girish from Tata Medical and Diagnostic, Madam Rajni Ved, MD NHM, distinguished guests of the dais, officials from Kamrup districts, dear students from IIT Guwahati, Asha workers, my dear friends, ladies, gentlemen, and friends from media. At the very outset, I'm very happy to be part of this MoU signing function of today. As we have already heard, starting from MD NHM to Mr. Girish, Rajni ma'am, and Professor Iyer. So what we can say that lot of hard work and preparatory work has gone into already in this project. Now it's time to roll it down and make it, functional at the ground level. In Assam, we have the experience of working with different type of organizations. Let us take the example of Tata's. So it's a very good initiative, and I must thank Tata Group for extending their help for this particular project. With Tata's, we have already been doing this Assam Cancer Care Foundation, which is like a role model for the country. Wherever you go, the other day I was in Delhi, somebody was talking about the initiatives of Assam under cancer care. So we have been working with them, and I am confident that this particular, though it looks a very small project as of now, but I think that will create a lot of impact in the days to come, not only for the North Guwahati block, but for the state as a whole and for the country as well. So far as Bill and Melinda Gates Foundation is concerned, I know of their good work they are doing across the country, particularly in the health sector. And most of the, I will say that majority of the initiatives they have been taking in the different parts of the country in the health sector. So we are very happy to be uh, partnering with the foundation, and I hope that their rich experience across the country in the health sector will definitely help us to deliver better. Again, for the Tata's, they have already shown that they are working in 8 or 9 states, in particularly primary health or in cancer care or other aspects of the health. So they also bring with them a lot of rich experience that will help us in fine tuning the pilot project and make the learning and understanding very clear, so that help us to replicate these measures in the days to come. IIT Guwahati, it's like whenever there is any crisis or there is anything, we look forward to the IIT. What Professor Iyer was mentioning about, there was a good, initiative taken by IIT and Health Department, AHI, that is the high level of, medical and technological center, which has been rolled out in the current, calendar year, and that also will give us a very good result. And here, since this particular unit is based in IIT, I am quite confident that that will generate lot of confidence, that will generate lot of learning, and that will pave the way for replication of this particular initiative across the state. So, and let me talk about our health minister. He has been very instrumental in all the initiatives taken by the department. He always guides us. He always, puts a lot of his very straight questions. So we are happy, sir, that you are here today. MD NHM has been taking a lot of initiatives. So I congratulate her for this particular initiative. I think on the dais, everybody has visited Kolar. So I got the invitation from Mr. Girish and Ashish. I will try to come and see what you are doing there and what else we can do in the state of Assam with Tata Medical and Diagnostics. So this is in fact a very proud moment for, I will not bifurcate that for health department or IIT or foundation or Tata's, this is a proud moment for each one of us, because the purpose remains that how we provide, accessible, equitable health to all the people. And as rightly pointed out by Mr. Girish, that generally, I accept, because not only in Assam, everywhere in the country, the health system is very, very reactive. That's a reality. Whether we accept it or not, whether we want to cover it with something or not, health system is reactive. So it's a time that we move from the reactive system to the proactive system. And let me just, I will not take much of the time because a lot of things are already said. But let me tell you, the technology is the greatest divider. So let us put the technology in use and we will see the wonders which it can do to the last person standing in the queue. So मैं आशा रखीશું कि हमार જે આજે MoU સાઇન હોવો યાતે that will pave the way for the better and transformed health system not only in the North Guwahati but across the state. And I will request all the three partners. I am also the partner, but I will request MD and IIT and Tata MD to, fine tune the modalities of, making this particular initiative successful. And whatever help is needed from the state government, I can assure you of any help. 24/7 we are available under the dynamic leadership of Honorable Chief Minister and Honorable Health Minister. We don't have any holidays and all. So absolutely no issue, 24/7. And I wish this particular initiative a grand success and look forward to working with all of you. Thank you so much.
Thank you, respected Avinash Joshi, sir, Additional Chief Secretary Health. Now I would like to request Dr. M.S. Lakshmipy, MD and HM, Professor Parameswar Iyer, Dean IIT, Mr. Girish Krishnamurthy, MD CEO Tata Medical, so to come forward for signing of MoU for the pilot project.
आप एक काम कीजिए उठाई ले जाक ना उठाई এডাল পুলি উঠাই লৈ যা লাইভ হেৰি হৈ আছে না আমাৰ ৰেকৰ্ডিং বিলাক হৈ আছে ৰেকৰ্ডিং বিলাক লাটৰ কেনেকৈ সাইড কৰা ঠিক আছে হ'ব দে
I request for a photograph.
Thank you.
Thank you. Sri Kekop Mohanta sir, Honorable Health Minister, Government of Assam is always an inspiration for us. Now I would like to request Sri Kekop Mohanta sir, Honorable Health Minister, to deliver his speech.
Good afternoon. Additional Chief Secretary Avinash Joshiji, Director NHM, Dr. M.S. Lasmipriya, Professor Parameswar KIR from IIT, Dean Public Relations, Mr. Krishnamurthy, MD and CEO, Tata Medical and Diagnostics Limited, Dr. Rajni Ved, Director Health, India Country Office, Bill and Melinda Gates Foundation, and officials from Health and Family Welfare Department, Secretary Barnali Sharma, and other officials, Joint Director, Health Kamrup, and OSD NHM, and other from North Guwahati Block, PHC, and আৰু আশা বাইদেউসকল, আশা ছুপাৰভাইজাৰসকল আৰু সাংবাদিক বন্ধুসকল, I am glad to be present here. The signing of MoU between NHM Assam, Tata Medical and Diagnostics Limited and IITGuwahati for pilot implementation of primary and secondary healthcare transformation and digital nurse center platform in North Guwahati Block PHC of Kamrup. I believe this MoU will prove to cater the need of the people of North Guwahati in healthcare by providing easy access, better treatment through digital nurse center platform. I had the opportunity to visit Bangalore along with NHM team, ED NHM Manoj Chaudhary and Superintendent DMC Abhijit Sharma. Before this, our MD NHM Lasmipriya also visited this Bangalore in Kolar, and personally experienced the working of the digital nurse center platform there. The works of Tata Medical and Diagnostics Limited is commendable, and their dedication to provide the better healthcare to the last person in the need applicable, and I hope this MoU will be very beneficial to the people of the entire state in the future. মই আপোনালোকক লগতে দুই এটা কথা ক'বলৈ বিচাৰিছো যে এতিয়ালৈকে আপোনালোকে হেলথ কেয়াৰ ল'বলৈ মানে স্বাস্থ্যজনিত কাৰণত আপোনালোক মানে স্বাস্থ্য বিষয়া ডক্টৰ তেওঁলোকৰ চলাই আছে। এতিয়া টেকনলজিৰ জৰিয়তে প্ৰযুক্তিৰ জৰিয়তে আমি আপোনালোকৰ ওচৰলৈ যাবলৈ ওলাইছো। আমি চেষ্টা কৰিম যে ঘৰে ঘৰে স্বাস্থ্য সকলোৰে ওচৰলৈ আমি যাবলৈ ওলাইছো। এই কাৰণে যে এই প্ৰযুক্তিৰ যুগত আমাৰ সৌভাগ্যৰ কথা যে ইয়াত IIT-খন আছে, গতিকে আমি বহুত প্ৰযুক্তিৰ সহায় পাইছোঁ। আমাৰ অতিৰিক্ত মুখ্য সচিবে ইয়াত এখন হস্পিটেলৰ কথা কৈ গৈছে, যিখন আমি প্ৰযুক্তিক টেকনলজিক আমি বেছি প্ৰাধান্য দিছোঁ, যিখন এতিয়া নিৰ্মাণ হৈ আছে। আৰু আপোনালোকৰ সকলো প্ৰত্যেক ঘৰ গৃহস্থীৰ আশা বাইদেউসকলৰ সহায়ত আমি তেওঁলোকৰ সকলো পাৰ্টিকুলাৰ ডাটা আমি সংগ্ৰহ কৰি ইয়াত সেইখিনি মজুত থাকিব। আপোনালোকক নিজেতো কণ্টেক্ট কৰিবই, আপোনালোকক তাৰ মাজে মাজে যিখিনি কণ্টেক্ট কৰিব লাগে, যোগাযোগ কৰিব লাগে, আমাৰ তৰফৰ পৰা কণ্টেক্ট কৰা হ'ব। আপোনালোকক কোনটো কথাত কেনেকুৱা ধৰণৰ চিকিৎসকৰ প্ৰয়োজন, কেতিয়া সেইজন চিকিৎসকৰ লগত আপোনালোকক যোগাযোগ কৰি কেনেধৰণে চিকিৎসা প্ৰদান কৰিব পৰা যাব, এই গোটেইবিলাক আপোনালোকে প্ৰথমতে অনলাইন যোগাযোগে আপোনালোকৰ কথাখিনি আগবাঢ়ি যাব। আৰু ক'ৰবাত যদি টেলিকমিউনিকেশ্যন কৰিব লাগে, যে আপোনালোকে যোগাযোগ, এতিয়া ধৰক কলাৰত আমি দেখিলোঁ প্ৰতিটো চাব চেণ্টাৰতে কোনোবা যদি গৈছে, চাব চেণ্টাৰত থকা CSO গৰাকীয়ে, NM গৰাকীয়ে তেখেতসকলে তাৰ পৰা যিখন হস্পিটেলত যোগাযোগ কৰিব লাগে, যোগাযোগ কৰি তেওঁলোকে ভিডিঅ' কনফাৰেন্সিঙত তাৰমানে দেখা দেখিকে ডাক্তৰৰ লগত কথা পাতিছে, সুধিছে, প্ৰেছক্ৰিপশ্যন দিছে, টেষ্ট কৰিছে, কোনটো ৰিপৰ্ট কি পাইছে, তাৰ ওপৰত তেওঁলোকে আপুনি গুৱাহাটী মেডিকেল কলেজৰ ওচৰত গৈ বহি দেখুওৱা, আপোনালোকৰ চাব চেণ্টাৰটোত বহি গৈ পেলাই দেখুওৱা, একেই কথা, কোনো ডিফাৰেঞ্চ নাই। গতিকে এতিয়া মাননীয় মুখ্যমন্ত্ৰী ডক্টৰ হিমন্ত বিশ্ব শৰ্মাৰ নেতৃত্বত সৌভাগ্য আপোনালোকৰ তেখেত বিধায়কো যে আমি স্বাস্থ্য সেৱাটোক তেখেত স্বাস্থ্যমন্ত্ৰী থকাৰ পৰা এতিয়ালৈকে আপোনালোকৰ ওচৰলৈ লৈ যাবলৈ বিচাৰিছোঁ, যে আপোনালোকক যাতে আমি ওচৰলৈ লৈ যাব পাৰোঁ। মই অৱশ্যে আজি 20 বছৰ মানৰ আগতে অষ্ট্ৰেলিয়াৰ এখন হস্পিটেললৈ গৈছিলোঁ, এনেকুৱা চাব চেণ্টাৰ সৰু, গৈ পেলাই তাত মই তেতিয়া এইবিলাকৰ লগত সম্পৰ্ক নাই, মই তেতিয়া MLA হোৱা নাই, MP হৈছিলোঁ, আৰু MP হৈ অলপ দিন এনে আছিলোঁ। তেতিয়া তাত দেখিলোঁ যে হস্পিটেলখনত গাঁৱৰ প্ৰত্যেকজন মানুহৰ ৰেজিষ্ট্ৰেশ্যন আছে। যদি তেওঁলোকে খবৰ নকৰে, হস্পিটেলৰ পৰা ফোন কৰি খবৰ কৰে যে আপোনালোকৰ এইটো টেষ্ট কৰিলেনে, এই বছৰ আপোনালোকে এইটো কৰিলেনে, আপোনালোকৰ ব্লাড প্ৰেছাৰ কি পৰ্যায়ত আছে চাইছেনে। এই ধৰণে মানে 20 বছৰৰ আগৰ কথা কৈছোঁ, মই এখন ঠিক চাব চেণ্টাৰ সৰু, আমিও চেষ্টা কৰিম যে আমি তেনেধৰণে আপোনালোকক স্বাস্থ্য সেৱাটো আপোনালোকক ওচৰলৈ লৈ যাবৰ কাৰণে, আৰু তাৰ কাৰণে আজি এই ব্যৱস্থাটো আমি আৰম্ভ কৰিছোঁ। ইয়াত সহযোগিতা আপোনালোকৰো লাগিব, সহযোগিতা আপোনালোকৰ নিশ্চয় প্ৰয়োজন আছে, কাৰণ সহযোগিতা আপোনালোকৰ থাকিলেহে আমি এই কামখিনি কৰি যাব পাৰিম। নহ'লে আমি এই ধৰণে আমি চেষ্টা কৰিলেও আগবাঢ়িব নোৱাৰিম। গতিকে আপোনালোক নিশ্চয় সহযোগিতা থাকিব। এই কাৰণে কৈ আছোঁ, কোভিডৰ আগত এটা পৰিস্থিতি বেলেগ আছিল, কোভিডৰ পিছত কেইটামান কথা আমি শিকিলোঁ। কি শিকিলোঁ? যে কোভিডৰ পিছত আমাৰ ইয়াতো এতিয়া বহুতে ঘৰত থাকি কাম কৰে, দৰমহা পাই ঘৰত থাকি কাম কৰে, ৱৰ্ক ফ্ৰম হোম, অনলাইন হৈ আছে। কোভিডৰ পিছত আমাৰ মুখ্যমন্ত্ৰী যেতিয়া দায়িত্ব ল'লে, লাহে লাহে কি হ'ল, আপোনালোকে সব চাৰ্টিফিকেট কোনো অফিচলৈ যাব নালাগে, অনলাইন ঘৰত পাই আছে যিকোনো খবৰ। এইবিলাক আমাৰ টেকনলজিটো বেছি ওচৰ চপাই আনিবলৈ বাধ্য কৰালে। আচলতে আমি হয়তো যিটো 10 বছৰত আগবাঢ়িলোহেঁতেন, 2-3 বছৰত মানে কোভিডে আমাক বহুত ওচৰ চপাই দিলে, যে আমি টেকনলজি ফ্ৰেণ্ডলি হ'লোঁ, মানে টেকনলজি ফ্ৰেণ্ডলি হ'লোঁ। গতিকে আমি স্বাস্থ্য ক্ষেত্ৰখনতো এইখিনি আগবঢ়াবলৈ বিচাৰিছোঁ, আৰু আপোনালোকক আজি সহযোগিতা পাই খুব ভাল লাগিল। মই অভিনন্দন জনাবলৈ বিচাৰিছোঁ। I congratulate NHM, MD NHM and all team, and MD NHM actually headed by Lasmi Priya and Avinash Joshi. He also chairman of this committee, executive committee. Then and our Krishnamurti, our Tata Medical and Diagnostic Limited. Tata নাম ক'লে আৰু ভাৰতবৰ্ষত দ্বিতীয় নাম ক'ব লগা নাই। য'ত টাটা আহি গৈছে তেতিয়া আপোনালোকৰ ইয়াৰ কনফিডেন্ট আপোনালোকে ৰাখক যে এইটো বেটাৰ সাৰ্ভিস হ'ব। গতিকে ইয়াৰ পিছত আপোনালোকক মই কংগ্ৰেচুলেট কৰিব বিচাৰিছো। I congratulate the IIT Guwahati, especially Professor Iyer. Professor Iyer, he is very, very interesting. All the development work or technology, I congratulate again. And I want to congratulate our Gates. I want to congratulate Bill and Melinda Gates Foundation, Dr. Rajni Vaid here. I congratulate because of them. Their support, we are able to signing MoU here. Tata, NHM, IIT. আপোনালোকক সকলোকে পুনৰবাৰ ধন্যবাদ জনাইছো আৰু এখেতসকলক অভিনন্দন জনাইছো কাৰণ আমি ইয়াৰ দ্বাৰা এইখিনি যাতে আগবাঢ়ি যাব পাৰো আৰু অতি সোনকালে হ'ব আৰু এই বিষয়টো যোৱা আগষ্ট মাহত গৈ আমি চাইছিলো ইয়াৰ আগতে তাৰ পিছত এই সময়খিনিৰ ভিতৰত গোটেই তেখেতসকলে সাৰ্ভে কৰি মানে এই কথাটো এনেকুৱা নহয় যে আমি কাৰোবাক লগ পাইছো এমও কৰিছো ফিউচাৰ কিবা কৰিম এটো নহয় we already confirmed and we survey all the things and field we survey the field and after then we sitting here and sign MoU. It is confirmed. Now we execute the this nerve center and other facilities this digital system. Again, I congratulate all আৰু আপোনালোকক ধন্যবাদ জনাই মোৰ বক্তব্য সামৰিছো ধন্যবাদ
Thank you, sir. At the outset, we would like to express our gratitude to Sri Kekhab Mohanta, sir, Honorable Health Minister, Government of Assam, for attending the meeting by managing time within his busy schedule. Thank you, sir. We would like to express our gratitude to respected Sri Avinash Joshi, sir, Additional Chief Secretary, Health and Family Welfare Department, for attending this meeting and providing the guidance. We would like to thank Bornali Sharma, Madam, Secretary Health, MD, NHM, Dr. M.S. Lakshmi Priya, Madam, Professor Parameshwar Iyer, sir, Mr. Girish Krishnamurti, sir, Dr. Rajani Vaid, Madam, Director, Bill Melinda Gates Foundation. We would like to thank all the officials from Health and Family Welfare Department, NHM official, Joint Director of Health Service, Kamrup Rural District, team from IITGuwahati, team from Tata MD. We would like to thank media personnel present in the meeting. Thank you very much. We have arranged the high tea for all the participants. We are requested to join for the high tea. Thank you. Sahar ব্যবস্থা